Yat Shelly Rexley Jim Yinchie, Vice President of the Navajo Nation. Kinchin Yinchle, Trachin, Bashishin, Kian Ani da Shichina, Kidne da Shinale, Zensades Adona Shatzed Don in Holiaque, Kiahst, Nana Totla Kade, Dost Elchit as Ahol Yeshi Adonaga. Koyat eto Hen Hideshnil, Kodoshin Eya, Double a garnic, a shot neck, a geltrasnilo. Department of Health with Diego Hatelia legislation enacting the Department of Health was signed yesterday by the President of the Navajo Nation, the Honorable Ben Shelly. I just want to highlight some of the positive aspects of this legislation. One, we firmly believe that we are a sovereign nation. And as a sovereign nation, there are certain essential governmental functions that we cannot, should not ever give away to other sovereigns, other entities, organizations. These are basic governmental functions. And one of that is our ability to regulate and monitor programs within the Navajo Nation's jurisdiction. And health is one of them. We want our people to have access to quality health care. So we want to make sure that all health providers on Navajo offer quality health care. We want to make sure that they meet all the requirements. And so we decided to create a Department of Health. This is not something that will happen overnight. It will take a few more years and a lot of hard work. This means that we build capacity. We will have to hire new people who are experts in policy making, who are experienced in rule making. And as we begin to move on this, all stakeholders will be involved. There will be public hearings, there will be consultations, there will be public input from stakeholders, there will be plenty of time for negotiation, drafting and crafting language to ensure that all regulations are fair and that they're also commensurable with other health codes like those of the federal government. We want to make sure that our people are safe. The Department of Health does not only cover health facilities like the 638 programs, it also means creating regulations for safe food in restaurants that are on the Navajo Nation, to ensure that there are safety codes for swimming pools at hotels on the Navajo Nation. It also means working with the Department of Agriculture to make sure that we somehow create a system that will take care of animals dying out there and rotting, and make sure that birds are not carrying one disease from that to different places, to watering holes. And so a Department of Health is so much more than just health facilities. It encompasses so much. It deals with Environmental Protection Agency, it deals with waste management, and it deals with transporting health patients. And we want to make sure that all of these ensure the health of our people, that we are healthy. And that's what this Department of Health legislation does. It's an enabling legislation. Another example is Medicaid. I understand people are concerned, but that's not going to happen overnight too. Several federal laws need to be changed at a congressional level. That will take work, 3, 4, 7 years. So It's a few more years before we start running our own Medicaid agency. In fact, it states that we should do more due diligence. And we will do that. And that's what this enabling legislation does. And in so doing, we will also identify the critical areas that need some establishment. And so we will be training people, hiring people, working with different companies to help us build a healthy Department of Health. It is going to allow us to work together to make it happen. It's going to take a lot of work, a lot of resources, but we must be willing to work hard. And we all look forward to doing that. Thank you.